Welcome, dear friends. Today we are going to learn about gout. By watching this video, upon completing this topic, the students shall be able to describe the etiology and pathogenesis of gout. They will also be able to name the sign and symptoms of the disease. They can mention the complications of the disease, and ultimately they can suggest diagnosis and treatment for the same. Now let's take a look about what exactly is gout. Gout is a complex form of arthritis and it can affect anyone. Here, in case of gout, there is sudden severe attacks of pain, swelling, redness, and tenderness in the joints. Often, the joint at the base of the big toe is affected. Now, why does there occur such sudden severe attack of pain? Is the basic reason is deposition of uric acid crystals in between these joints. The attack it mostly occurs suddenly while the person is sleeping at night and he wakes up due to the pain, feeling that the toe is on fire. The affected joint is hot, swollen, and so tender that even the weight of a sheet on it may seem intolerable. The symptoms they come and go. Now, the gout is a joint disease. The cause of it is sedentary lifestyle and obesity, harmful products, especially meat and beer. If you have a kidney disorder and due to which you cannot excrete uric acid from your body, at that time also it may result into gout. Now, what are the symptoms? Here, the symptoms are inflammation and redness of the joints. There is increased temperature of that aching joint, and also there is severe pain, and that pain especially occur at night. Now, what can be the treatment? The treatment is use of anti-inflammatory drugs and painkillers. Now, which is the part which is mostly affected due to this gout is the joints which is present at the fingers, the knee joint, the ankle joint, and the big toe joint. Now, why does gout occur? Because of deposition of uric acid in the joints. This gout is a very popular form of disease and it affects almost 4 to 6% of population. Now we'll take a look towards the symptoms of gout. There is intense joint pain. Mostly, gout is going to affect the large joint of the big toe, but it can occur anywhere in the joint. Other common points are your ankles, knees, elbows, wrist, and fingers. The pain is likely to be most severe within the first 4 to 12 hours after it begins. The next symptom is lingering discomfort. After the most severe attack of pain, it subsides after 4 to 12 hours. Then the joint, there is experienced joint discomfort which may last from few days to a few weeks. Later attacks are likely to last longer and affect more joints. There also occurs inflammation and redness. The affected joint or joints become swollen, tender, warm, and red. There is limited range of motion. As gout is going to progress, it becomes more and more difficult to move the joint normally. So ultimately, we can say gout can disable the movement of that particular joint. Now, what are the etiological factors? The first and foremost important factor is food. Okay, the purines and proteins rich food, mostly the seafood, beer, and sweetened drinks. Okay, the purines and proteins in this particular food content, they undergo metabolism and they produce uric acid. Uric acid is a metabolite of purines and proteins. Okay, so if you are high protein rich diet at that time, there are more chances that uric acid is going to get accumulated inside the body. Second etiological factor is inefficiency of the kidneys to excrete the uric acid. If your kidneys are unable to excrete the formed uric acid inside the body, then the uric acid will go on accumulating inside the joints, and it will result into gout. Now, what are the risk factors? First is diet. As I told you, eating diet rich in meat and seafood and drinking beverages sweetened with fruit sugar, that is fructose, increase levels of uric acid in the body, and beer is highly harmful to the body. Next risk factor is obesity. Being overweight leads to high production of uric acid and less removal of uric acid from the kidneys. So ultimately, it is going to um, accumulate uric acid in the body. The third reason is medical condition. If you are suffering from high BP, diabetes, kidney diseases, then there is a chance that you might too suffer from gout. Certain medications like thiazide, diuretics, aspirin, etc., they cause uric acid to accumulate inside the body. Next reason is family history. If anyone is suffering from gout in your family, then there is a chance that you might too fall prone to that disorder. And lastly, the factor is age and sex. Now we'll take a look towards the pathogenesis. When you've taken diet rich in proteins and purines, or when you have sedentary lifestyle, or when you have kidney dysfunction, all these things, it leads to increased uric acid level in the body. This increased levels of uric acid causes the uric acid to form needle shaped urate crystals. These urate crystals, they are accumulated in the joints, and due to this there occurs pain, inflammation and swelling. Now let's take a look towards the complication. What are the complications of gout? The first is recurrent gout. In recurrent gout, people experience the attack several times in each year. Some people, they never experience the sign and symptoms of gout, but some people, they have recurrent symptoms of gout. The medications might help to prevent these attacks of recurrent gout. If this type of gout is left untreated, then it can cause erosion and destruction of the joint. The second complication is advanced gout. Here, the untreated gout, it may cause deposit of urate crystals to form under the skin in nodules, and that is called as tophi. Tophi can develop in several areas such as your fingers, hands, feet, elbows, or Achilles tendons along the backs of your ankles. The tophi usually aren't painful, but they can become swollen and tender during gout attacks. The next complication is kidney stones. Urate crystals may collect in the urinary tract of the people with gout, causing kidney stones. Medications can help reduce the risk of kidney stone. Now we'll take a look towards prevention. The first preventive measure is drink plenty of fluids, because if you take in plenty of fluids, the uric acid, it will get removed from your body. The second is you have to avoid alcohol, and especially you have to avoid beer. Next is you have to have your proteins from low fat diet. Then you have to limit intake of seafood, and you have to maintain desired weight. Now, what will be the diagnosis? First thing is joint fluid test. Here, some small amount of fluid is taken from the affected joint, and it is observed for presence of urate crystals using microscope. The second is your blood test. Using the blood test, you can measure the concentration of uric acid and creatinine level in your blood. The third is X-ray imaging. You can take an X-ray and look at the deposited crystals in the joints. And lastly, you can go for ultrasound or dual energy CT scan. The urate crystals are detected using this procedure. The treatment for gout includes NSAIDs, mostly ibuprofen and naproxen. They are the most common choice of drugs. Secondly, colchicine. It is special drug and which is used to reduce the gout pain. Next, If the pain is not controlled by NSAIDs or colchicine, then you have to go for corticosteroids, mostly prednisone. It controls the inflammation and pain. Now we also have medications that block uric acid production. These drugs include xanthine oxidase inhibitors, including allopurinol, alloprim, lopurin, xyloprim, and febuxostat, Uloric. These limit the amount of uric acid which is produced in the body. Next class is medication that improves the uric acid removal. These drugs, they are called as uricosuric drugs, and it includes probenecid, probalan, and lesinurad. Uricosuric drugs improves kidneys' ability to remove uric acid from the body. So friends, this was all about uric acid deposition in the body, that is gout. Thank you for watching.